Okay, thank you, Brother Riyad. Assalamu alaikum. Bismillah.
Walaikum salam.
Thank you for inviting me, and hopefully, inshallah, we'll get some information out there. As you rightly said, this is not uh, medical advice for specific areas, but I'm hoping that our Muslim brothers and sisters and anybody listening it will clue them into certain areas. Maybe they're not familiar with what's happening in the medical field, so that you will see how this applies to you and your family, and how you can take things in hand at a much earlier stage. The whole uh, healthcare system, in a way, is geared towards um, taking care of you after the fact, sort of. After the fact, that means you have developed some chronic ailment, or you're troubled by some problem that there's most of the time maybe there's not a cure, but you have to live with it and navigate the medical care system as best as you can. So, what I want to present to you today, and in this first slide, is the fact that there are so many chronic diseases that are prevalent among us today. And if you go to this first slide, where I enumerate some of the chronic diseases. Now, I'm sure in our families, we're all familiar with this. I mean, those people who are young, they have their mothers and fathers and uncles and aunts that are they're familiar with all of these things. So most of us have come across some of these problems in our family. Um, we also have to help to take care of our family. So we are aware of most of these things. I've enumerated there in the first line, type 2 diabetes, which is very common, high blood pressure, hypertension, coronary artery disease. These are all abbreviated CAD, HTN, and type 2 diabetes mellitus, obesity, cancer, low back pain, chronic obstructive pulmonary disease, osteoarthritis, metabolic syndrome, which we commonly call obesity, and osteoporosis, frail bones. Um, Here is the important point that I want to make right in the beginning, that 80% of the chronic diseases are preventable with lifestyle change. Now, these lifestyle changes have to be made the earlier the better. You have, first of all, to be aware that you're susceptible. For example, let's say your mother is diabetic, your father is diabetic, or maybe both are diabetic, which is a 100% chance that the siblings are going to be diabetic. So if you know that in your family you have people with certain ailments, high blood pressure, coronary artery disease, then you have to have a high index of suspicion or awareness that you are going to possibly be genetically susceptible to this similar disease. Now, let's stay with the diabetes example. Uh, with type 2 diabetes, most people develop actually type 2 diabetes when they're in their middle age, late 30s, 40s, 50s. Not that they don't have diabetes earlier in their life, they have the predisposition, but they start to manifest the symptoms and signs of the disease as they get older. They gain weight, the blood sugar goes up, and if they are not aware of it, many people they don't think that they are diabetic, but they go to their doctor. It's a very important point that I want to make. The doctor tells them that you have the word I hear a lot is touch. You have a touch of diabetes. Well, I want to say to you that the touch of diabetes is just as bad as diabetes. I mean, it means that this is the stage where you should start figuring out how you're going to delay the actual onset of overt diabetes. You can stay as a pre-diabetic for many, many years and avoid all the complications if you start following the right diet, maybe start on some medication, whatever your doctor will decide is the best approach to that pre-diabetes. But pre-diabetes is not a good thing to have. So you have to not have a false sense of well-being that, oh, I'm not diabetic yet. Well, by the time you get the full diabetes, you have now developed a lot of the complications which are life altering. Um, you may all know of your family members having kidney problems, having to go on dialysis, heart problems, needing bypass surgery, um, eye problems, getting blindness, um, toes getting infected, all of these peripheral vascular disease. So there are so many uh, life altering complications of diabetes as we go along that you want to try and avoid all of this. So tonight's talk really is to point you in the direction what is prevalent in your society and how you should become aware, at least have a high index of suspicion that you can also develop the same problems. And therefore, how do you prevent it? And I'm saying here that the vast majority of these chronic ailments are preventable. The earlier they are recognized, you don't wait for them to take hold of your body. You start looking to see how can I prevent. So prevention is the name of the game if you're going to uh, extend your life, your life, and not only extend your life but have some quality of life. um, in the older population we say it's not only being alive but being alive with a certain quality. um, we all want to live to 100, and therefore it's possible. um, you saw this former president Jimmy Carter just lived to 100 and had a very useful life. I mean, he was involved in so many wonderful activities. So again, I mean, Jimmy Carter, I don't know if you know, towards the end of his life there had malignant melanoma, one of the worst skin cancers you can have, and he was treated and he survived and had a good quality of life towards the end. So, what you want to have is intervening early and knowing that these chronic things are going to happen, and start seeing how you're going to take measures in your own life to prevent some of them. Are you going to prevent 100%? Probably not. But you want to prevent as many of them as possible. Um, Sorry, I have a little dry throat here. Um, Let me get a little bit of water. Otherwise, my throat is going to go out. So, prevention, prevention, prevention. And tonight's talk, I'm also going to emphasize uh, one other thing, and that I'm going to zero in a little bit. If we have the time, we are going to we're going to spend a little bit of the time on um, exercise, which I will show you is one of the main prevention methods of prevention that we have available to us. Um, Prevention and exercise in our society is a big business. You see all the gyms all around our neighborhood. People, when they're young, they're into exercise, but as they get older, they fall off, and that's the time when they should be exercising more regularly. So Physical activity in this slide I have here, I'm giving you an idea how few people, uh, non-smokers, how few people have a BMI, a basal metabolic index that is below 25, um, which is good. People who are indulging in eating fruits and vegetables regularly, regular physical activity. So these are methods of prevention that we will go through one by one. I think in these slides I have listed 6 items that I would like to bring to your attention tonight. And the first one is diet. We go to this. Are we down to the second slide? Yeah. The here we have the an idea of the diet, the standard diet that we live in the United States, and um, we are subjected to the standard diet around us, um, which which includes fast food because we are always in a rush, always in a hurry. How can we plan ahead in terms of a better diet? The diet has too many carbs, not enough fruits, vegetables, and not enough protein. So we want to make a special effort, and this involves planning. If you know that you're not going to be home and you're not going to be in a situation where you're going to be able to have a proper diet, then you have to maybe prepare your meals ahead of time and prepare the kind of meals that you want to be ideal for you. One which is high in fiber, vegetables, fruits, whole grains, legumes, and the diet is a whole uh, talk on its own. I mean, you have a lot of information in the on the internet these days. Some good, some not so good, but at least it clues you in, and you have to use your own judgment. And what is important here is that we all grow up with certain foods, likes and dislikes, and every ethnic minority have a certain. You may like rice, you may like roti, you may like things that you grew up with and the family grew up with, but it's not necessarily the best balanced diet for you. And therefore, if the diet is contributing to your getting diabetes, for example, at an early age because of its high caloric content, then you have to say, well, how do I look at this analytically and try to modify the diet as early as I can? Because I don't want to be pre-diabetic for too long. I want to have no diabetes if I can manage it that way. And if perchance I am a diabetic for genetic reasons, or however my inheritance is such, then how do I delay the onset of the complications of diabetes, which are so horrendous, and change your life in such a dramatic fashion, that I should take precautions to look at my diet critically. And there's the old saying that you are what you eat. So this is very, very true. And you have to look at what you're eating and how you're eating, because it does make a difference in the long run. Now, I have about BMI there, but basically, what BMI means, it means that you're not too overweight. Your weight is under control, and your weight can only be under control if you are proactive, that you're stepping on the scale periodically, once a week, twice a week, and seeing what's happening. You don't become overweight overnight. You become overweight over a period of time. And if you are conscious of it and you are aware that eating is one of the pleasures of life, but then if eating is detrimental to your well-being, you have to look at it analytically and say, how am I eating? What am I eating? Is there something that I'm eating that is not in keeping with managing my weight and managing my blood sugar and keeping me in the best state of health? So I have here, there is no one best diet, but the diet, the one that the patient will follow. If the patient will follow that diet, if you will follow that diet, then that's the diet that is that's going to be the one that you know, you can always find in that diet something that you like. And the one that comes to mind so many times is called the Mediterranean diet. You can check into that and investigate, and you will see that's a diet that is more plant based, um, you know, and more fruits and whole grain and all of that sort of stuff. So there are so many diets. Diets are, you know, it's like exercise. Everybody comes up with a different diet every day. But in the end, it's what you like to eat and how you balance that versus what is good for your health. Um, Next slide. Let's see. I've given you broad recommendations here in terms of the diet. Are you going to be measuring, you know, so many grams of fiber and this and that? Probably not, but it gives you an idea what you're looking at and what how you decide the amount. Um, in terms of the fiber is important. How much fiber you have per day, then how much protein you're required to have. Um, 5 feet tall, 100 grams, and then you add 5 grams for each inch that you go over that amount. So those are guidelines that you can. But Brother Riyad has put together a very nice diagram here. Let's go to the next slide. Yes, and you know it gives you a guide: breakfast, lunch, snack, dinner. So it's not a starvation diet. It's a balance. You have a nice variety, and you have to make an effort to stay within these the goals. And you can see you have proteins, you have quinoa, you have fruits, orange. You have your dinner. You have soup. You have slices of, you know, and banana and all of that. So it's a variety. And is it different from what you're accustomed to? Maybe it is, but this is where you're consciously making an effort to look at your diet and see where you can modify it and change it little by little. And like all of the things that we're going to talk about today, everything is incremental. You have to start somewhere and then move along little by little along the way towards the goal. So once you become familiar with what it is, then you have to work out the what the item of food is and how much of this item that you're allowed. Um, and not go overboard because I like this certain item a lot, so I'll eat a lot of it. That's not the idea. The idea is a variety of foods, a variety of colors. You see, the colors of the food also are important. So the more color, the more quality, the fresher the food, not being processed and things like that are all important in terms of having fresh food and having a balance in your diet. And you know something that from the time you start changing this, you yourself will see the way you feel. The way you feel will be the proof is in the pudding, they say. So you will have an immediate change in your way you feel, and it will help you to adjust. So it's a process of adjustment. Um, do I eat chickpeas every day? No, but at least one meal you have that, and you have so many different various varieties of food that you can do. So each category here, you have so many choices. Among fruits, you have so many different fruits, whatever is in available at that time of the year. We live in America where every fruit is available whole all year around. They they bring mangoes from the southern hemisphere. When there are no mangoes in Florida, for example, we can find mangoes in the supermarket. So, but likewise, you have to improvise and look at what you want to eat and how you're. And if you are a person that like menus, then you can have a menu that you can work with, maybe a week's menu or a month's menu or um, all of this you can work out. The internet is full of information on all of these, and you have to use your good judgment. And maybe if you have access to a dietitian or somebody who deals with nutrition, you can get some advice. But most of it is self-explanatory, and uh, if you uh, use your own judgment and use your own portion control. Portion control is the name of the game, that you don't go overboard with any one item. Then you can make the right choices. Next slide, Riyadh. Yes. Okay. So we move on. That's about diet. And we have, if you've noticed, we have put all of this into six categories, I think. So we have talked about diet as the first category. Now we are moving on to physical activity. And of all the things that we will cover today, I want to emphasize physical activity. Physical activity is the major cause of morbidity and mortality. That means illness and death. This is the thing that you have within your grasp that you can do something about, whatever age you are, whether you're 25 or you're 85. There's something that you can do to change your level of physical activity, which will determine your state of health, your ability to get around, your ability to extend your life with some quality. As I said before, it's not just being alive, but being alive with some quality, that you are able to enjoy life. And that for in order to do that, you have to um, the physical activity has to be part of your life, your daily life as you go along. You have to be um, involved in some kind of physical activity. And there are people who, especially the older people, who they decide in their own minds that they have arthritis, so they can't exercise, or they have or they're overweight, so they can't exercise, or they have some other reason why they always give themselves a reason why they can't exercise. Even raising your finger, I say, is a form of exercise. So no matter what state of health you're in, you can exercise, and it's going to help you to have a quality of life. Muscle, you lose muscle as you get older. You lose muscle mass, and they have found that muscle mass is maintaining your mass, and loss of muscle mass is a huge threat to longevity. People get frail, they get they're not walking properly, they fall. All of these things are, so maintaining your muscle mass and maintaining your the integrity of your movements, your flexion, extension, and all of that is so important. Um, if you remember in the first slide I had about low back pain, The reason I put low back pain there was because low back pain is one of the number one diagnoses that people have among the diagnoses of illnesses. And back pain, uh, you know, I always tell people when I was younger, I had lots of back pain. And as I went on and I found out the secret to preventing the low back pain, it's all about activity. It's not about getting MRI and going to the orthopedic surgeon. It is about what you are doing. How do you uh, stretch your muscles? What kind of exercises you're doing? Because this is the balance that you need. Um, in uh, the same slide, inactivity. So I have it highlighted here. Inactivity is the single biggest threat to health. Um, a fundamental statement, a very striking statement. I hope that it strikes you the way I want it to, because I want to make the point tonight that inactivity, the singlest biggest threat to health. Cardiovascular exercise means that your heart is getting some exercise, strength in the muscles, resistance exercise. You see people pulling those rubber bands and all those kinds of things. Balance. See, the older people there, they have their stick, they have their walker, they have all those things because they have now gone beyond that stage where they are no longer able to compensate for the things that have happened. So the prevention of all of those things is with exercise. So the right, correctly structured exercise is what you want to. And most of us study all kinds of things. Um, and I would suggest that you study a little bit about exercise because there's so much that you can learn, so much that I have learned personally as I have gone along. In medical school, they don't emphasize all of this, so you have to learn it as you go along. And there's so much focus these days on these diet and exercise because people have been looking for the solutions to many of these problems, and they have found that it's not in medication, but it is in exercise. So if and if all these pills are expensive, they have to be covered by your insurance and all of these things. But exercise doesn't cost anything, but it involves you. You have to get involved in it, and you have to see it. You have to see it as something which is beneficial to you. And nobody likes to exercise. I mean, I know that. Nobody likes to exercise. But if you start looking at the benefits of what it will give you and what it will do for you as you go along in your life, as you get older, then you're going to start. The earlier the start, the better you off you are. And I'm not talking about exercise or running and jogging and all of this. Later on, I'll come to that and I'll make that point that it is the exercise that you will do is what you can tolerate and what you can make work for you. And you're starting low and going slow. That's the name of the game. I've given you a guideline here, which is the common guideline that they have found that works for most people, and that is the goal is 150 minutes per week of moderate intensity aerobic physical activity. That means 30 minutes a day, 5 days per week, comes to 150 minutes. What does moderate intensity means? Moderate intensity to understand it very simply is that you should be just mildly short of breath. The exercise you're doing for that 30 minutes should make you mildly short of breath, where you're able to breathe, but you're not, on unusually. That gives you an idea of how vigorously you're going to exercise. Um, okay, so physical activity starts where you are. What does that mean? That means that uh, if you have, for example, if you have arthritis in your knee, then you're not going to want to run and jog. So you have to use good judgment. But that doesn't mean that you can't exercise. You have your upper body. You can do upper body exercise. Um, so if you're deconditioned, you've not been exercising most of your life, again, you have to start somewhere, but you have to recognize that this is something I want to do and that it's going to help me in the long run. Now, I have there, for example, you hear of a lot of people falling and they can't get up. They have to call the ambulance to get them off the floor. So there are exercises to help you, to train you. How do you get off the floor when you fall? And the core muscles are what are going to help you to get off the floor when you fall. Of course, to begin with, you don't want to fall. And to prevent falls, there are many exercises. That's a whole different talk and lecture. But just as a matter of understanding, if you're sedentary, you're not exercising, you've not been exercising, then you have to start someplace, and you have to decide where am I going to start and what am I going to do. You don't want to exercise that muscle or that joint that is painful. You want to gradually do range of motion and try to get it in a better state before you do any vigorous exercise that will aggravate it. So that's where you can get the advice of a therapist, physical therapist, or you can get the advice of your doctor or somebody who is knowledgeable in that area, and they will help you to decide where you're going to start and what you're going to do. But once you start, remember the exercise is what you start slow, and even 5 minutes, even 2 minutes, even 3 minutes is a start. So it means that you are buying into the idea that this is something I want to do and I want to enhance and I want to increase. So sedentary, if you're sedentary and not the condition, and if you just lack knowledge of what you need to do, you can get a trainer, or you can read, you can research it and decide, well, okay, I'm going to start with, at this level. Don't start picking up 10-pound dumbbells and start lifting them up and start, because that's counterproductive. The fact is, you're going to get hurt, you're going to get injured, you're going to get turned off from exercise, and maybe for weeks and months you can't go back to the exercise. So you want to do things that you're comfortable with, starting very slowly, starting with very few repetitions, maybe 1 or 2 repetitions, and see how it feels. Uh, I mean, what kind of activity I like. Not everybody like all kinds of exercises. So there are a variety. I've listed just a few there. For example, walking, biking. If you have bad knees, you don't want to go and jog, but maybe you can ride a stationary bicycle. Swimming is one of the excellent exercises, but you have to have access to a pool or some, I mean, there are public pools, there are private pools, but there are pools at the gym that you can access. So if you're over 65, all these health insurances give you what they call silver sneakers, and silver sneakers entitle you to so many different exercises that you can do. There is dancing. People like dancing. The music helps you to move your limbs and move your joints. And if that's, I mean, sometimes they say the music distracts you. You may be going for 5 minutes and you don't realize that you've gone for 5 minutes already. So you're using various distractions to help you to do what you need to do. Uh, So here in the last point I make is that any improvement in movement reduces mortality, and improves outcome. Again, all of this is not being done in a vacuum. It's being done with the aim to make you more functional, to prevent you from falling, and to increase your cardiovascular fitness, your heart. As you exercise, your heart exercises also. So it is important that you enjoy what you're doing, because when you enjoy what you're doing, you will do it again. You have to do a little bit 5 days a week. Okay, if you can't do 5 days a week, do 2 days a week to start with. Just do it and see how it works out for you. Start one day a week. If you are not doing one day a week is exercise. So you've just implemented something which you were not doing last week. So now this week you've started doing one day a week, and do it when you are not. It's funny that some people say, "Well, when I get home, I'm too tired. I can't exercise." But you just see, if you do it for 5 minutes, you will see that your body will respond. And when you were thinking that, oh, I'm so tired, I just work all day and come home, but you'll be surprised that you do a little 5 minutes or 10 minutes, your body wakes up to the prospect of the improvement in what is available. Let's go to the yes. So the exercise plan, um, um, again, you have to have a plan. You have to come up with a plan. You have to work out your own plan, or somebody has to work it out for you. In a person who is inactive, who is not doing any exercise, 2 days per week, strength training, one day upper body, one day lower body. Here you're separating the upper body from the lower body, 20 to 30 minutes each session. These are just guidelines that I'm giving you, so you get an idea what will be your goals. Focusing on these compound movements that they call them, deadlift, bending over, rowing, overhead press, squats. Squat is very important in terms of keeping your strength in your legs, your balance, and all that. Pull ups. So all of these, if you're going to the gym, are available. But if you're not going to the gym, then there are ways that you can create all of this at home, just using a chair. You can recreate all of these exercises. Um, 3 to 4 days of cardio, 20 minutes high intensity workout, and all that. These are all recommendations that are frequently put out there as goals that you want to move towards. As I said, if you're not if the recommendation is 150 minutes a week, then you start with 5 minutes or 10 minutes. You don't want to get up to 150 minutes right away, because then you're going to get injured and you're not going to continue, which defeats the whole idea of getting into the rhythm of what you want to. So you want to start slow, go slow, and listen to your body. I mean, if you are a person who is exercising 5 days a week, and suddenly your body is telling you one day that, today I don't feel like doing it, well, do less. Maybe not stay away from it completely, but do less. But at least keep the rhythm going, because it's when you stop, when you break the rhythm, that you get into that situation where you don't go back to it. So keeping the rhythm is important, keeping the timing. Um, Varying the exercise is very important. Varying it, mixing it up. If one day you're swimming, the next day you do the treadmill, the next day you do the bicycle. So there you see, by doing that, you're using different muscles, and different muscles, your body doesn't get worn out. Because if you're doing the same exercise again and again, day after day in and day out, then you're going to get injured. Your muscles are going to start hurting. Your joints are going to give you problems. And then you're going to spend more time at the orthopedist office than at the gym. You don't want that. You want to use your own good judgment. If something is happening, using heat, using rubs, home remedy, massage, all of that, so that you keep your body in such a shape that you are able to exercise, you're able to flex the muscle, you're able to extend the muscle, because that's what's going to make the difference in bringing blood. When you exercise, think about it. Your heart has to work harder, and you are bringing blood into areas where blood has not come before, right? Because blood brings the nourishment and the healing blood cells that will heal your ailments and the way you feel. So, exercise is a wonderful tonic for the body. And as you exercise, you're going to see how much different you feel. And people who exercise regularly, many of them cannot stop because they get a high from it. So, you don't want to necessarily go to that point, but at least you're moving your joints, you're moving your muscles, you're stretching them, you're doing what you need to keep you physically fit and in a balanced state of health. Um, okay, stress management. We this is another pillar. We all have stress in our lives. I mean, stress is something which you cannot avoid. Um, there's no life without stress, but stress is also part of the challenge. And the balance of all of this, how do you navigate without. Here we talk about the childhood experiences. Some people have bad childhood experiences that tend to go on with them in their life, but there are ways of getting around all of that. And you know family life, and if in a family environment you can help one another to alleviate stress, it goes a long way towards you know keeping you in a balanced state of health. So that homeostatic balance that we talk about there is the balance that we need to achieve in order to have the uh, the peace and the comfort, and all of that comes with so many factors that go towards that, to achieving that. Chronic stress leads to a lot of negative things in your life, negative coping skills. Um, they have found that it affects your DNA and your it goes down, all the way down to the structure of your finer structure of your body, modifying the genetic makeup of your body. It affects your immune system, your ability to fight infections and to deal with your day to day. There are bacteria all around your body which you're fighting off day in and day out. But if you are in a good state of mind, then you're in a good state of health to deal with all of this stuff. Weight gain, appetite increase, insulin resistance, blood sugar problems, poor sleep, poor mood, memory problems. So stress affects a wide variety of so stress management is itself. You can sit down and say to yourself, where is my stress coming from? And you can write down a few things. Maybe it's in a relationship. Maybe it's a spousal relationship. Maybe it's with your children. Um, we say that life is short, and if people realize how short life is, a lot of things they will do differently. But we never stop to think how short your life really is. And sometimes, if you take that moment to sit down in your quiet time and say, let me look and see what can I do to alleviate some stress in my life. There will always be some, but maybe there's one that is overwhelming and that I can deal with. Maybe there's a person, maybe my boss, maybe somebody that I'm dealing with that is causing me stress that I can um, sit down with and exchange some ideas and see how can I alleviate this from my life. And you'll be surprised that sometimes if you have If you sit down, you list six things that are causing stress in your life. Maybe you can do something about one or two of them. That will go a long way towards alleviating chronic stress. So, stress management is important, and that's another goal that you have to have. How much control do you have over the important things of life? You know, when people have control of their life, they feel much better, and there's less stress. They feel the impact of it all. So the perception, a lot of it is perception. You have to uh, first um, understand where it's coming from and what can I do about it. So you may have an ability to make a big impact on it or little impact. So once you're in charge, you are much more equipped to deal with stress. Uh, next slide. Let's see. Next slide. Sleep. We are at sleep, right? So this is another important factor in your well-being. Sleep. Average sleep for adults 7 to 9 hours a day. Um, you know the digital world in which we live in. We are always with our cell phone and always having a screen in front of us, either at work or at home. Um, you know, it's hard to think that I don't remember which year the cell phone came into being, but it's hard to believe that at one time we didn't have cell phone and we didn't have all this information coming at us day in and day out, emails, this thing, that thing, you know. So these things are affecting our health. I mean, we we are sort of adapting and adjusting to the age of these implements that are in our life, but they do affect our sleep. Um, Sometimes you find that the cell phone is sleeping with you in bed. So all of that, you know, you need to um, deal with and say, okay, I'm going to put this implement away, and I'm going to now dedicate so many hours to rest. And I've listed here a few of the things. For example, the brain clears its impurities during sleep. If you're not clearing the impurities in your brain, the brain has a special system. They call it the lymphatic system, which operates only when you're sleeping. And that's when the brain is cleaning out itself of all of these impurities so that when you wake up, you're refreshed. So you need a certain number of hours of sleep, and this is something that you have control over, and you have to create the situation in your wherever you sleep in your bedroom. You dim the lights, you take off the TV at a certain time, you take off any songs at certain time. um, um, some songs are good because some people feel when they hear water falling, it puts them to sleep, things like that. But you have to know what are the things that will be conducive to your best sleep so that you can sleep soundly. Uh, Sleeping pills are not the solution. You should be able to make the situation such that you can create the environment. And I have about CBT here. I don't know, you might have heard about CBT, cognitive behavioral therapy, which is administered by a therapist. This is the number one treatment for lack of sleep. And here they are making they're doing a sort of therapy so that you don't have to take medications. Uh, Many of these medications are addictive, so if you can avoid them, the better. But you have to create the environment for sleep, and once you create that environment, then you're on your way, and you have to create the environment for so many hours because you need a certain minimum number of hours. If you're not getting enough that sleep, then you are not functional and your health is going to be impaired. Okay, next, let's see. Next is the substances. Now, the I put substances because I don't know uh, my audience that well. These may be relevant to you, it may not be relevant to you, but be aware that these things are around and people, uh, at least we know that they are, indulging in them. A lot of people are looking for um, solutions in these areas. People smoke. I mean, people consume alcohol, even though it's outlawed in our society. It's hard to believe that in America, alcohol was banned once. It was outlawed, and tobacco and all of these things were banned. Even this cannabis, THC, was banned. It's all little by little has crept into the mainstream of our lives. So people are on these things thinking that they will find solutions in them, but there are no solutions. These are all risky things. These are all toxins. Nicotine is a toxin. Alcohol is a direct toxin. Um, Cannabis is a toxin. So there are so many psychiatric ailments now that they're recognizing related to these things. You're hearing every day people running off the road, people um, accelerating their car when they should be decelerating. They're going at 100 miles an hour in a 15-mile-an-hour zone. These are all things that people are losing control of their faculties, and they're not able to. So these are all people you can rest assured you don't hear about it, but they are all on some kind of a toxin that is affecting their ability to um, have a peaceful and normal lifestyle. So there I put the recommendations, what the national recommendations are, but I will say to you that with alcohol being a toxin, no amount of alcohol is good. Zero is good. It's the best. Tobacco, the same. Smoking, I mean, everybody's aware of smoking causing lung cancer and emphysema and all these sorts of things. So these are the end result. We see them after the person has become 40, 50, 60 years of age when they can't breathe. They have to be on oxygen. They have to be on various. So these are all things that are very, very, um, you know, detrimental to their health. This social connection, relationships, very important. Um, in recent times, you may not have heard that it's been linked to Alzheimer's disease in many old people. Um, we are living in a society um, where people are almost becoming having no relations. You know, over the years, because I've been in practice here in Florida, approaching nearly 50 years, um, there are people, I have patients who have been my patients for over 40 years. And I have realized that there are people who, either because their family are passing on or because of strained relationships, having fewer children or having no children, there are people who have nobody else in their life. Um, the longer we live, the greater the chance that we are going to be without relatives. And there's a phenomena which is becoming more and more noticeable, is that people are having no relative. They call it a kinless society. Um, Kinless society means you have no family. And can you imagine your life without any family? Um, we are in a position where many of us are migrants. Half the family are in a different country. Some are in Pakistan, India, Guyana, Trinidad, wherever we come from. Some are here. So there has been disruption in the family, you know, relationship in terms of the nearness to family. When we grew up in the villages, everybody was there. Grandfather was there, grandmother was there, But this is a phenomenon where social connection is very important. So maintaining your social connection with your family, um, not getting into a situation where you are alone. Loneliness, loneliness is a killer. I have it there. I put it on the slide. Okay. So lifestyle and having your relations and having regular meeting with your friends and family, very important in the prevention of Alzheimer's disease. Alzheimer's disease, as we go along, and you live in this country, is going to be the number one killer. Not cancer, not heart disease. Alzheimer's disease is going to be the number one. So if you can do anything to prevent Alzheimer's, this is it. Social connections, maintaining social connections with your family, your children, your cousin, know where they are, keep in touch with them, spend a time on a weekend where you can Zoom them and talk to them and see them and know where they are, what's going on in their lives. And keeping that connection going is very, very important in terms of prevention. It's not prevention of another major disease called Alzheimer's. So this is also important for health. Next slide is behavior. So behavior change strategies, you have to have your priority. Not all the things that I have talked about today are going to be relevant to your life or your family's life. But look at it critically and see which is the one you want to take on. You know, we are early in the year 2025. You can't take on all of it, maybe, but maybe you can take on one or two. But you have to make a conscious effort to say, this is how I'm going to be taking charge of my health. And therefore, I'm going to choose to deal with stress. I'm going to choose to deal with exercise, or I'm going to choose to deal with changing my diet in a very effective and fundamental way. If my family have eaten roti and rice all their life, doesn't mean I have to continue to do that. But if I'm going to continue to do that, how do I do it effectively? By looking at the quality, the quantity, how much I'm allowed, what illness do I look forward to? I'm being proactive. I'm looking at my family tree and saying how many people had bypass surgery in my family, how many people have diabetes, how many people have high blood pressure. Am I going to reduce the salt in my diet? How much salt am I putting in my diet? Um, so there's a lot of that you can modify. It's within your control, and this little talk that I'm bringing to your attention is to point you in the direction that you yourself have got so much control over this that you can make fundamental decisions and decide what your priorities are. Um, the one thing that I want to say to you and that I have found is that people, when when you go to your doctor, there are two possibilities. Either the doctor will take charge of the encounter, or you will also be part of that encounter. Um, People get scared. They don't know what to ask the doctor. They don't interact with the doctor properly. There is a term that you will hear a lot of called in America today. Having been in the field for so many years, I have gone through all the changes. And today, the one in vogue is called shared decision making. You will hear that term more and more. Shared decision making. What does that mean? That means that you are helping, you're sharing with the doctor to make decisions that concern you. Shared decision making. That means the doctor is not paternalistically making the decision on his own. He is helping, you are helping him to make the decision about you because you are eventually the person involved. So, shared decision making is becoming more and more important. And that means you have to know what to ask. You need to have an agenda when you go to the doctor. What am I going to accomplish by going to the doctor's visit? But that will make it more meaningful for the doctor and for you. So you need to be involved, asking the right questions. You don't want to, there's a limited time that you're there, and you have to decide that, okay, these are the things that I want some answers on. And therefore, you go with your, write it down, especially in older people. Write down what you want to find out or what you want to ask about. Because when you get there, you forget, and then it doesn't result in any benefit to you. So the shared decision making and being involved, being proactive is part of staying healthy and taking part in your own health care. Um, in the old days, it was not like that. The doctor was in charge of everything. Now it's changing. The patient also has some say so in what happens to their body or what decisions are being made, what tests are being made, why is the test being ordered, what do you expect from the test, what is the result of the test. Don't go to the doctor and get tests ordered and then you don't know what the result of the test. 6 months pass and then you find out, what happened with your mammogram? What was the result? Oh, I didn't know. The doctor ordered it. I went and had it, but I didn't hear about the results. So being proactive means that every test you have, oh, this is another thing. Every test you have, especially if you're young, make sure you get a copy of the report and keep it in your health file. Create a health file, whether you're old or young. You have a CAT scan, get a copy of that result from your doctor. You're entitled to it. Put it in your health file. After 7 years, the doctor doesn't have any obligation to keep that report in his file anymore. Medicine is changing so rapidly, practices are being sold. You don't know where your records have disappeared to. All of those things are happening. So, with electronic medical records, even medical records, the electronic records are disappearing. So, keeping your own file with all the major things that are going on in your life. A copy of your blood test should be in your file. When did you have your blood test last? All of those things are going to be important. So it is being proactive. That's my bottom line. That's my sincere advice, that you be proactive and plan. Your doctor's visit should be a planned visit, and it should be something which is meaningful to you and to the doctor. And when you should know when you're going to follow up on certain things. Don't bury your head in the sand, and you don't know this, you don't know that. People, I ask people, well, what did this show? That will that show? I don't know. You have to know. You have to be. If you ask, you will get the answer, but you have to be proactive. So, identifying in this conclusion slide, I have the chronic diseases are common. I want to do prevention. Prevention is important. Um, by practicing prevention, lifestyle modifications, I am adding quality to my life. I'm looking at what is contributing to my not feeling well. I'm depressed. I'm sluggish. I'm gaining weight. I'm this. I'm that. It doesn't happen by magic. It all happens over a period of time within your preview. It's happening to you, and you know it's happening. And how do you intervene to prevent it, or to stop it, or to change it? Then you have to focus, and you have to come up with an action plan, just like everything else in life. If you don't act on it, you're not going to change it, and it will go on from year to year, to the point where you'll become inactivated. You will not be able to walk, you will fall, you will this, your blood sugar is high, your kidneys are failing, you've got chest pain, you're you got high blood pressure. Let me say one word about high blood pressure. I'm so sad about this. I mean, I see so many people who are on high blood pressure medications, and they run out of pills. They don't fill their medications in time. And when you run out of medications, what happens? The lid is off the pressure cooker. You know, when the lid is off the pressure cooker, what happens? The pressure goes very, very high. And that's when they stroke out. People who are on blood pressure medications all their life, suddenly they run out of their medications. Why? Because, oh, the doctor didn't call it in time, or I didn't tell the doctor that I was down to the last pill, and it was Saturday morning and I can't get the doctor, and the doctor is not available. Somebody else is covering him, something. Yeah, these are all silly excuses that have fundamental uh, effect on your life. When you get a stroke, it's a stroke, it's finished. It's after the fact. The brain has been damaged. You can't bring it back. There are things that happen to people in their lives that are not reversible. They are treatable, but not reversible. So something has happened in your life that has changed your life. You can't go back to work. You can't walk. You're paralyzed on one side. You got a heart attack. They've had to open up your chest and do bypass or do this and that. So if you, I'm not saying that these things will not happen to you in your life. What I'm saying is, by intervening in a meaningful way, by being proactive, by discussing things with your family and with your friends and with your getting second opinions, not depending on one opinion. If something is critical in your life, make sure that you get a second opinion about it. Talk to somebody, talk to your friends, because that's where you will get the correct information, and you will make the best decision by involving people that are more knowledgeable than you, and that are going to, as you know, that anything you're doing in your life, if you get more opinions, the better decision. And the same is true of healthcare. um, we are moving into an era now where more and more patients are going to be taken care of not by doctors, but by physician assistants and by nurse practitioners. I mean, I'm not saying that that's a bad thing. All I'm saying is that you may not find the same doctor every time you go. You may not find the same nurse practitioner every time you go. You may not find the same person who is knowledgeable enough to give you the right kind of decision that you need. So, all of this has to mean that you have to take more care with what you're doing, and you have to be more involved. One last thing I want to say here is that we did a little demonstration some last year, I think, at the mosque, on the exercise and all the different movements. You remember?
Yes, I
Um,
have it recorded.
you have it recorded, right?
Yeah,
And that's
I'll
a
attach
that's
the
a very
video.
good that's a good very good basic thing that you can do in your home, And we also incorporated the benefits of all the movement in Salah, and where Salah covers all of these movements and stretching and all that. And you see how many people, I mean, they as they go along in life, this is all tie in with what we have talked about today. So in summary, we have covered the six basic things that are involved in your lifestyle, and things that will make a fundamental decision in your health care. Thank you for your listening. And if there are any questions, then I can try to answer them. And I don't know if we have the time for that, but whether now or the next time, you decide that. Brother, how can I answer that? I'll answer it this way: that you know, our salah and the movements we make in salah is one of the things that have convinced me that Islam is really God's religion. If you look at it, we don't have time tonight, but if you look at Salah and all the movements we are making in ruku and sujood and and the toes, you know the toes, your big toe is so important in maintaining your balance. You don't realize it. We take it for granted, but all those people who are having balance problems, if they strengthen up their big toe, you know how we hyperflex our big toe when we go down? You know what I mean, right?
Yeah.
Many people can't do it. I mean, for some time, when earlier, many years ago, I couldn't do it, but I started. And then I realized that this toe is so important in helping my balance. And, so in answer to your question, in briefly, I think if those people who are sitting in chairs um, start looking at stretching and doing some of these things that we have been talking about, they may find out that they can do a lot more than they are doing rather than taking to the chair. So the chair is the easy way out, but many of them are young people that can really, maybe we can have a little session at the masjid on weekends for those people and say, come and let's see if you can really uh, really take part in Salah in a more meaningful way, and you will see how it is. I remember Brother Edwin Muhammad. I don't know if you remember Edwin. Yeah,
Yeah.
Brother Edwin was 89 or nearing his 90th year, and he still. I used to ask him. I said, "Brother Edwin, you don't want to sit in a chair?" No, he will still come and sit on the carpet and everything. And he was an amazing person that he kept on praying his salah in the usual manner till the end. And I think that it can be done. We just have to find out what it is that's causing them to go into the chair. Most of the time, I'll venture to say it's back pain or knee pain. And I think most of those could be fixed. Not all of them, but most of them. And they will feel a lot better. And that's something that, we can make judgment on people, but we can only say that if they're interested in seeing whether they can improve, that we can look into that and see about it. Um, so that's my answer to
Yeah.
that. It's a good point. I mean, you have to tell the provider what is going on exactly so they can get a good better idea how to help you. Because if you don't come up front with what your feeling is, then you'll go back home feeling the same way, and the problem that might have had some solution then doesn't have any solution, and then it adds up and it gets worse, and things get from one bad day to the next. So our people are a little bit timid, and they get afraid, and sometimes um, we some doctors get a lot of training on how to make people comfortable, and some don't. And in the quickness of the encounter, you don't really always get to the point where you put people at ease to be able to have them divulge what their real problems are. You know, sometimes we need one or two visits to to find out exactly what the problem is, right? And if the one and two visits is 6 months apart, then it will take 6 months to find that out. So that's another problem. So, but they should be upfront with what is going on and be truthful about it, and then hopefully they will get the help that they need.